So what we have here is a 25 years old male. He came to me with the complaints of left-sided abdominal pain. On evaluation, we found out that he has a left renal calculus, which was about 1.4 centimeter in. So initially on his presentation, he said that he wants to get the stone removed, but when the stone size, I suggested him to go for a RIRS, which is retrograde intrarenal surgery, which is an advanced form of endourological procedure in which we remove the stones of the kidneys without any cuts or holes. So you see, any kind of cuts or any kind of injury is bad injury. So any injury that we avoid is a kidney we save. So you can see on the screen, that is the left ureteric orifice, that is the connection between the kidney and the urinary bladder. So he underwent a minor small procedure known as stenting to make the ureteric orifice and the ureter accommodative for the procedure of RIRS. Now we are proceeding for the second step, and this is the second stage of the procedure in which we do a sheath insertion. The first step is insertion of the guide wire. You can see on the screen, this is the guide wire in place. Then we will proceed for sheath insertion. So this is the ureteric sheath and this is the suction channel. This is the advanced form of ureteric sheath known as the French sheath. The tip is flexible, so we can go into each of the calyxes to suck out the stone powder once we are done with fragmentation of the stone. Now you will see, I will insert this sheath under the guidance of the C-arm. That is the stone and the sheath is in place. So this is the flexible ureteric scope which we use to do a RIRS procedure. You can see the tip is freely bendable on both the sides, also rotatable, so we can access the kidney in all directions once we are inside. This is the flexible ureteroscope. So now we are starting the RIRS procedure. We are advancing through the sheath to access the kidney. You can see we are inside the sheath now and we'll be reaching the kidney in no moment. And here we are inside the kidney. You can see the calyxes. These are the calyxes, the parts inside kidney. Now our job is to locate the stone and break it into pieces. So one by one we check all the calyxes. So you can see this is the upper calyx, but one infundibulum, that is a draining part of the calyx. The infundibulum is very narrow, that is not accommodating the scope. It's impossible to go inside without opening up the infundibulum. That we will do with laser. You can see under the C-arm, that the scope is just in front of the stone, but under the vision of the scope, the stone is not visible. Now we are inside with the laser fiber. We are seeing on the screen is a laser fiber. This is a thulium fiber laser, and we will proceed with making an incision over the infundibulum. Slowly we are opening up the infundibulum so that we can access this. After opening up the infundibulum, you can see by using the laser we have opened up the infundibulum. We are accessing the stone now. This is the stone that was bothering him. Now we will proceed with fragmentation of the stone, and after fragmentation using French sheet we will take out all the fragments and make him totally stone free. Now we are proceeding with laser fragmentation of the stone. This kind of narrowings of the infundibulum happens when you have a stone for quite a long time and the stone irritates the infundibulum, causing it to stenose and fibrose. So it's always advisable to not ignore your stones and get it looked after.
Dr. Pratyush Krishna Mahanta, Consultant Urologist. Thank you.